Hi friends, I am Dr. Sandeep Bhasin from Carewell Medical Center. Today I am taking one topic that is related to anti-aging, and I keep making some of the videos on basic how to prolong your life, how to live healthy, and today I have come up with a very important topic, and that topic is, have you thought what is the reason of diseases like diabetes, hypertension, PCOD, and many weight gain? So there is one thing that is common in all these problems, and that thing that is common is insulin resistance. Yes, insulin resistance is a big factor that is causing weight gain, obesity, that is causing diabetes, that is causing hypertension, that is causing PCOD, infertility, migraine, headache, and many other problems. So what is insulin resistance? Let's try to understand that. Insulin is a hormone which basically opens the gates of the cells for the glucose to flow in. Whenever the body needs glucose to come inside the cells, they need insulin to be there so that the glucose can enter inside the cells. If insulin is not there, the glucose would not be able to go inside the cells, like the doors of the cells to insulin are locked. Insulin is the key that opens that lock and opens the doors, and the glucose can go inside the cells and the cells can use it and they can get the energy. Now what happens is, if you're taking too much of glucose in your diet, every time when your glucose goes up, insulin also goes up to bring it down and bring the glucose into the cells. If you're taking a lot of sugar and carbohydrates in your diet, the insulin level is going up very frequently. And what insulin does, that it also promotes the growth of fat cells. Insulin is a very anabolic hormone. What I mean by anabolic, it increases the fat cells, it increases the muscle cells also, but mostly the fat cells. Insulin pushes the glucose inside the fat cells and make them grow bigger and bigger and bigger. So as it goes up, it not only brings the sugar down, it also makes the fat cells bigger and bigger. And because of that, whenever the insulin is going up, you are becoming obese and fat. So what is happening? You take simple sugars, you take candies, you take food which are high in carbohydrates, refined carbohydrates, insulin goes up, the fat goes up, you become obese, the fat cells become bigger and bigger. And one time comes when the fat cells are not able to grow any bigger. They have reached their maximum capacity. So what will happen at that point is that even if the insulin level is high, it will not be able to open the doors of the cells for the glucose to go in. And what happens is, this causes insulin resistance. That is, insulin hormone is no more working, no more opening the doors of the cells for the glucose to go inside the cells. So what are the consequences? Well, the consequences is, number one, the obesity is there, the insulin level keeps going up, and it is not working and functioning properly. So one of the thing that insulin does is, it also, if insulin is working properly, it causes the blood vessels to dilate. If insulin is not working properly, there is the insulin resistance. One, there will be obesity, because now the fat cells are not responding to insulin. The other thing that will happen is, the blood vessels will not be able to relax and dilate. So what will happen? You will have high blood pressure. That is one thing. Secondly, the chances of male infertility goes very high if you have insulin infertility, because you need the blood vessels to open up in the genitalias, in the male genitalias, to have erection also. If insulin is not working properly, that erection can be affected, male infertility can happen. In females, the insulin resistance can cause something called PCOD, polycystic ovarian disease, which basically is a hormonal imbalance in which insulin level is high, you are obese, not having regular periods. Females are having hair on the face just like males, they have a lot of acne on the face, and all these problems keep happening, and they are also not able to conceive. So one big problem with insulin resistance is not only heart disease, is not only diabetes, it is also infertility, both in males and females. Another thing, insulin resistance also causes migraines and headaches. This is now well proven that if insulin is not working properly, it causes vasoconstriction in the head, and blood is not able to reach to the brain and to the cells in the head, and it can cause headaches and migraines also. So that's another thing. In the skin level, when the insulin is not working properly, what happens is you can have skin conditions like skin tags, small tags in your neck area, in your back neck area, and around your neck and upper back. These skin tags, they tell that insulin is not working properly. Another condition, that is very common with insulin resistance is people start getting dark patches on the neck, on their armpits, on genitalia, sometimes on the forehead also, which is called acanthosis nigricans. What is acanthosis nigricans? This is a very dark, thick skin, which is velvety, which is dark, which is, thickened skin, basically because of insulin resistance. And it causes the proliferation of cells and melasma. There are a lot of papers that are coming that insulin level, when it is high, because it increases the growth of all the cells, it also increases the chances of getting cancers. All cancers increase when insulin level is high. So it is not only causing all these conditions, it is also causing cancer and also Alzheimer's or dementia. Your memory loss in old age is linked with insulin resistance. Friends, that Alzheimer is now called type 3 diabetes. So Alzheimer is linked directly with insulin resistance now, and we know conditions like Alzheimer's are linked with insulin resistance. So just look how many conditions are linked with just one thing, insulin resistance. How dangerous is insulin resistance? If you want to live a long life, healthy life, try your level best to overcome insulin resistance. Now we know, insulin resistance is there, what clinical features are there. Basically, the person will be obese, he may have skin tags, he can have acanthosis nigricans, dark patches on the neck, on the forehead, or if you look at the lipid profile, the triglyceride level would be high. The ratio between triglyceride and HDL, high density lipoprotein, is going to be more than 1.5, and if you look at the fasting serum insulin, it is going to be more than 10. If it is less than 10, between 7 and 10, then it is good. Less than 7 is ideal for fasting serum insulin. It shows that insulin is working properly. Now, what can we do to decrease insulin resistance? Now, friends, first very important thing, that there are medications like metformin and other, and really they are helpful. But alone medicines cannot help you to come out of this. This is a lifestyle problem, and you need to change your lifestyle for this. So what I have seen really working for insulin resistance very well is, number one, is intermittent fasting. Eat in a particular window, maybe 8 hours or 10 hours, and then try not to eat during the rest of the time. This is called intermittent fasting. I have made some videos on intermittent fasting. You can have a look at them. You can study about that. Intermittent fasting, basically try to eat within 8 hours window and not eat after 8 hours. So that is one very important thing. Okay, intermittent fasting, that really helps insulin resistance. Second, do not take sugars, candies, refined carbohydrates. Anything which is refined carbohydrate, which has a high glycemic index, which increases your blood sugar immediately, is not good for your system. So try to take a healthy diet, take some carbohydrates which are complex with the low glycemic index, take high proteins, with healthy proteins, vegetarian proteins, and take healthy fats. So reduce the use of sugar, sweets, soda, things which increase the level of your carbohydrates, glucose in the blood, and insulin resistance. That is second thing. Decrease your carbohydrates, refined carbohydrates, very important thing. Number third, what really very effective for insulin resistance is regular exercises. Please do regular exercise, even if you do for 20 minutes, brisk walk or some resistance exercise, weight training, anything is good that can help against insulin resistance, that will make your muscles work. And when the muscles work, if muscles are working and contracting, then muscles are the one thing that can antagonize the effect of fats and adipose tissue in the body. So more exercises you do, especially with your muscles, the more you can lower down your insulin resistance. That's another thing. Then coming to another thing, with the healthy lifestyle and regular exercises, there's another thing that is very helpful in insulin resistance. There are few supplements which I can tell you, like vitamin D3, which is often very low in most of us. Check your vitamin D3 level. If it is low, take vitamin D supplements. That is something really very helpful. Then few supplements like alpha lipoic acid. It is very good for insulin resistance. Alpha lipoic acid help for to overcome the insulin resistance. So that is another thing which I found very good for insulin resistance. And inositol is another thing that help in insulin resistance. Then coming to some common herbs that you can use. Cinnamon is a very beautiful good herb that you can put it in a green tea or tea, and also on your dal and on your vegetables. Cinnamon is one thing, okay, so that you can add a lot, that is thing. Then bay leaves, that is tej patta. So tej patta is something that you in a kitchen remedy. Start using it more in your green tea, start using more in your tea. So that is another thing people are using that has got good results. Then mustard seeds, methi ke dane, that have a very good role in lowering down your blood glucose and helping your insulin resistance to overcome that. So these are a few things. And another thing that I recommend is the water made up from bitter melon, that is the Karela juice, Karela water. That is something you can add on to the whole thing. Now, one thing very interesting I'll share with you, which I came across and I was not aware of it, is that camel milk is something that is being used with the children with type 1 diabetes, and they found that the camel milk is very helpful in the children who are having type 1 diabetes and even type 2 diabetes. So dairy products are not good for insulin resistance. That is well known, that milk and dairy products, because they're high in saturated fats, they're not good for heart, they're not good for your insulin resistance. They increase insulin resistance. But camel milk is something you can try if you want to improve your insulin resistance and you want to decrease your blood sugar down. So friends, with this I'll say a healthy lifestyle can give you many years, can keep you young and healthy for yourself, for your family and for those all around you. So keep safe, keep healthy. I'm Dr. Sandeep from Kerwell Medical Center. Thanks for listening to me. मेरे और भी वीडियोस हैं जो हमने बनाए हैं, हेयर ट्रांसप्लांट के ऊपर हैं, गायनिकोमेस्टिया के ऊपर हैं, लेज़र हेयर रिमूवल के ऊपर, राइनोप्लास्टिक के ऊपर, ऐसी बहुत सारी कॉस्मेटिक ट्रीटमेंट पे हैं, आप उनको देख सकते हैं.